Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I want to thank you and welcome all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. As we get started, I'd like to acknowledge and thank today's premier national sponsor, EMD Serono, and our national sponsor, Janssen Neuroscience. Support from MS community partners helps the MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Some say that wellness really begins with getting a good night's sleep. But about half the people living with MS experience sleep disorders. Today, we're looking at how sleep affects MS, and we'll gain some strategies to help manage sleep difficulties. I'm joined today by Dr. Abbey Hughes. Dr. Hughes is a board-certified rehabilitation psychologist and assistant professor in the Johns Hopkins University School of Medicine's Department of Physical Medicine and Rehabilitation. Her work focuses on individuals with multiple sclerosis and other chronic neurologic conditions. Dr. Hughes' research focuses on how behavioral interventions and cognitive assessment as part of comprehensive interdisciplinary care can improve functioning and quality of life for people living with MS. She's currently being funded by the National Institutes of Health to study the behavioral management of sleep disturbance in MS, and the National MS Society to direct a postdoctoral fellowship in MS rehabilitation research. Welcome, Dr. Hughes, and thank you for being with us today.
Thank you so much for having me, John.
Quality sleep is important to maintaining overall health and wellness, but sometimes it's hard to get. We've all had those sleepless or restless nights where we toss and turn and feel the time just ticking away 1 second at a time, or those other times when we feel like we're sleeping too much. Why is quality sleep so important to someone's overall health?
You know, that's such an important question, John. And as we think about sleep, as human beings, we were really evolved to spend about a third of our life sleeping. So it is an essential human behavior and it's essential function of our survival. So it's not just important for people with MS, but as human beings, it's something that is really built into our system. It's important for healing, it's important for our immune system, it's important for our mood, and basically maintaining homeostasis or being able to survive. I think as we have evolved as a society much more rapidly than perhaps our bodies have evolved, we started to think of sleep as more of a luxury or something that is nice to have, as opposed to something that is really ingrained within our cells for survival.
I'm sure some of us may be wondering what quality sleep is supposed to look like. Can you help us out there?
Sure. So quality sleep really means a lot of different things for different people. In general, you may have heard at some point that we all need 8 hours of sleep, and that's a bit of a myth. 8 represents an average number that was thrown out about, over the past couple centuries, and really the range for human beings ranges somewhere from 6 to 10 hours. And let's say your ideal sleep is somewhere around 9 hours. If you're getting 7 hours, you're going to feel more tired. If you're a 6-hour person, getting 8 hours might make you feel more tired or more restless or affect your mood. And so quality is not just about quantity, it's also about sleep staging. So thinking about for you, there are times where you might get 8 hours of sleep and feel great upon waking, and there's other times where you wake and you don't feel as rested. So depending on when we wake up and our sleep cycles that we go through the night and a million other variables that we could consider, including mood and seasonality, all of those different factors do affect sleep quality. And so what quality sleep looks like, the short answer is it looks like a lot of different things, but thinking of yourself and your own sleep when you feel rested and can function in the day is probably the best answer for that.
Can you explain what non-REM and REM sleep are and what the difference is between them?
Sure, that's a great question too. Sleep is generally divided into two different phases of non-REM sleep and REM sleep, but there's actually other stages as well. And so I encourage you, if you have a few moments, to Google stages of sleep, because as we go through the night, we start off in a very shallow level of sleep, so shallow that if someone were to wake you up when you were in the first stage of sleep, you would probably say that you were still awake, say, I wasn't sleeping. And as we go through the night, if we're staying asleep, we progressively get into deeper and deeper stages of sleep. And each stage, we think, is really important for different kinds of brain processes and body healing processes. There's also different ways that dreaming becomes involved in different stages of sleep. And so REM sleep is one of those stages where it's REM, or REM is short for rapid eye movement. And to be honest, there's so much research that has gone into understanding REM versus non-REM, but even then there's a lot of questions that still remain in terms of what the function of these different types of sleep are. We know that some are more for restoring function. We know that some are more important for consolidating of memory. But we know that all the stages are important. And so to be able to sleep continuously in order to go through all the stages is an important part of sleep health.
And when it comes to people who are living with MS, what are the benefits of quality sleep?
The benefits of quality sleep in many ways translate to daily functioning from a fatigue management standpoint. We know that about 90% of people with MS do experience chronic fatigue at various times. And so sleep is one aspect of management of chronic fatigue. And that's something that is really hard to manage at times. So that just from a fatigue standpoint alone, that's an important piece. We also think of if MS being a neurologic condition that affects the brain in different areas of the brain. If you have lesions in certain areas of your brain that affect the sleep centers of the brain as well, you might have more difficulty with sleeping. And so by targeting sleep behaviors through behavioral strategies of sleep management, it can help compensate for some of the damage that occurs as a function of MS. It's also really important in terms of management of side effects of medications. Some medications do cause more sleepiness or drowsiness. And so managing the sleep on top of that becomes an important part of MS management.
The term sleep disturbance is a general term for a wide range of sleep-related symptoms and disorders. What does it actually include?
So as a researcher, this is always a great question because it's such a general term. And there are specific diagnoses of sleep disorders that may fall under this umbrella of sleep disturbance. And so in MS, sleep disturbance can include a wide range of different diagnoses. Those include insomnia, which is the most common type of sleep disorder. And insomnia is defined as difficulty falling asleep or staying asleep or waking too early in the morning. There are other criteria for insomnia that include how often those symptoms occur and how long they've been occurring. That's a little bit outside the scope of our presentation today, but just know that there are very specific diagnostic criteria for insomnia. There are other types of sleep disorders, including sleep apnea, which affects about a third of people with MS. And sleep apnea is characterized by pauses or slowing of breathing during sleep. And that can happen because of obstruction, meaning there are parts of the throat, larynx and pharynx that become weaker and the muscles become weaker and start to collapse, which can make breathing difficult when you're asleep. Or it can also be what we call a central process or a brain process where there's sleep centers of the brain like the brainstem that regulate breathing. And when damage due to MS affects that part of the brain, that can also affect breathing during sleep and result in sleep apnea. So insomnia and sleep apnea are probably the most common sleep disorders that fall under that general sleep disturbance umbrella. And there are others as well, including restless leg and narcolepsy, which we can certainly talk about later today as well.
Can someone be experiencing more than one of these different sleep disturbances?
Absolutely. And what is probably most common is sleep disturbance or difficulty falling or staying asleep, which falls under that insomnia category. Sometimes that's the first symptom that people experience or the first way that they describe it when they go to their doctor. And so I often work with patients who've been diagnosed with insomnia, but then are later found to have narcolepsy or to have sleep apnea. So part of it is trying to figure out what is the cause of the sleep disturbance and then treating the cause if one can identify what the cause is. And it is possible to have multiple sleep disorders. That's why I think having a comprehensive team is really important and a sleep medicine specialist to identify if there is more than one diagnosis on board and if there are multiple treatments, how to balance and weigh the pros and cons of various treatments.
Well, I'm glad you mentioned insomnia, sleep apnea, and restless leg syndrome as three of the more common MS-related sleep disorders. You've done a great job explaining what sleep apnea is about, as well as insomnia. I'm wondering if you can describe what restless leg syndrome is all about. And then later in the program, we'll circle back to talk about strategies for managing these particular disorders.
Sure. Restless leg syndrome, sometimes also called restless limb syndrome, is a feature, it's a sleep disorder that is characterized by a really uncomfortable sensation in one's limbs, or either legs or arms, somewhere in the body, that often happens when the body becomes very quiet, like when one is preparing for sleep. And the way that people often describe it is it's not quite like an itch, but it's a really uncomfortable sensation that the only way to get rid of the sensation is to move your limbs, which is really kind of in the opposite of intending to sleep. So just when you're ready to fall asleep and just when your body gets quiet enough to fall asleep, you start to have this uncomfortable sensation that you have to move your limbs in order to stop that uncomfortable sensation, which then gets in the way of falling asleep. So it can be a really frustrating kind of disorder because of how much it affects sleep. And it is more common in MS compared to the general population and compared to some other neurologic conditions.
We've heard from Jan, who told us she was diagnosed with MS last year, and she feels like the stress of getting her diagnosis has impacted the quality of her sleep. Sometimes Jan has trouble falling asleep and then staying asleep, and she wants to know how she can tell if she should get some help. So I'd actually like to break Jan's question down into a few questions. To begin with, does it sound like Jan's sleep problems are related to her MS?
You know, without having an hour-long conversation with Jan in a clinical interview, I can't say definitively whether it's related to her MS or not. But certainly when people are diagnosed with a chronic incurable disease like MS, that is a major life event. That is a major stressor. And it can lead to insomnia or other types of sleep disorders when stress is a big component to that. Now, there are lots of other causes of stress in life, but MS can certainly be a cause of stress. And so we may all experience a phase in life where we find ourselves worrying more, worrying about the day-to-day, worrying what's going to happen in the future, maybe ruminating or thinking about things that have happened in the past, you know, going back to that moment when one was diagnosed, or you know, going back to a really stressful situation around making a medication decision. And sometimes some of us worry around bedtime. You know, we stay busy throughout the day, we stay distracted, and then kind of right when our head hits the pillow tends to be that, oh, now's the best time to start worrying about all of these things in life. And that can really be a central feature of MS and other sources of stress in life. And so the short answer is, are they related to MS? They certainly could be. And as I mentioned before, there's also biological processes or brain-related processes that are happening that can also affect sleep as well.
And how can someone tell if they're actually sleep deprived? Are there ways for someone to self-assess?
Absolutely. I'll speak to the insomnia criteria first. We all as human beings will have bad nights of sleep. We'll have nights where we just can't sleep very well. But if you notice a pattern where more than 3 nights per week, you're having difficulty falling asleep or staying asleep, meaning it's taking longer than 30 minutes to fall asleep, or if you wake up in the middle of the night for any reason. It could be to go to the bathroom, it could be, one of your kids wakes you up, something like that. If you're having trouble getting back to sleep within that same kind of 30-minute window, then that can also be a sign of insomnia. So from a very basic self-assessment, thinking about how long is it taking you to fall asleep? And if you happen to be woken up in the night, how long is it taking you to get back to sleep? And then importantly, how often is this happening and how long has it been going on? If it's happening more than 3 nights a week, that's definitely something to talk to your doctor about. And if it's been going on for 3 months or longer, then that's also something to talk to your doctor about. You could certainly raise the issue before that 3-month period, but from a diagnostic standpoint, typically that rule of threes tends to apply for insomnia.
And to Jan's specific question, if someone is experiencing sleep difficulties, when should they discuss their sleep problems with a professional? And who is that professional that they should be talking to?
I tend to lean toward letting your provider know, and let's say if your neurologist is the person who you are most in contact with, that's the person to know as soon as you start noticing the symptoms. They might not take action on it right away, but from a medical record keeping standpoint, it's going to advantage you to have that documented as soon as possible so that it can be tracked. And so it might not mean that you get treatment right away, but noticing when the symptoms start. And the reason I mention this is because, again, as human beings, we're pretty poor at recollection. Our memory for ourselves and our day-to-day schedule becomes really challenging after about 3 days. So keeping track of these things and putting it in your medical record is a great way to keep track of that. You had also asked about sleep deprivation, and sleep deprivation is also a generic or general term for not getting enough sleep. And a rule of thumb would be if you're consistently getting less than 6 hours and not feeling rested, so you're not a 6-hour person, that's a pretty clinical and often research definition of sleep deprivation. But that could also mean if you're someone who usually needs 8 hours of sleep and you're only getting 6 and you're chronically tired and not able to sleep, that could fall in that range of sleep deprivation for you.
Can you tell us what a sleep study is all about and who should be getting one of those?
It's another great question. So sleep studies range in what they look like. They can be conducted in a sleep lab or a sleep clinic, or they can also be conducted at home. And there are physicians who are dedicated to sleep medicine. Oftentimes these are pulmonary and critical care doctors who we've certainly heard a lot about in this past year with COVID. But really prior to the COVID pandemic, a lot of our PCCM or pulmonary critical care doctors have been involved in sleep medicine and sleep health. So oftentimes a sleep medicine specialist is someone who runs a specialty sleep clinic where you would be able to get a sleep study. And a sleep study looks like coming into a lab or getting a kit that is shipped to your home where you're connected to wires that monitor your brain waves while you sleep and also keep track of your pulse oximetry or the amount of oxygen in your blood. And so over the course of the night, as you go through different stages of sleep, your brain waves will look different. And so a sleep study really helps isolate how long is it taking you to go from full wakefulness to the first stage of sleep, to the second stage of sleep, and so on, how much time you spend in REM versus non-REM sleep, how much oxygen you're getting to your brain during sleep. And so it's a really specific diagnostic tool for determining things like insomnia, sleep apnea, restless legs, narcolepsy, and some other types of sleep disorders. In terms of how to get one, you can usually ask your primary care physician or your neurologist or any of your medical team to make a referral to a sleep specialty clinic. And depending on where you live in the country, if you are close to a major medical center, there's probably a sleep clinic there. If you're not close to a major medical center, there are sleep centers that pop up kind of like an outpatient physical therapy. There's also outpatient sleep clinic centers as well. Or increasingly with technology, there may be an option to ship one of these kits home, depending on the severity of your symptoms.
Are assessments and things like sleep studies normally covered by health insurance?
Normally, yes. And this is where individual insurance plans really vary. So reading the fine print is always such an important piece of this. And as with any other specialty service, if you need a referral, if you don't have the referral in place and you went to go get the service, it's possible that your insurance company would deny the service. So many of the medical challenges that we've talked about in other podcasts, and some of the barriers that patients with MS face is that referral piece. So I always recommend calling your insurance company at least once a year, or whenever you're wanting specialty services, just to confirm that the policy hasn't changed. And you'll be able to assess what your deductible is, what your copay is for this kind of service, because it really runs the gamut in terms of cost.
Paul wrote in telling us that he's been struggling with getting sleep. His vitamin D levels have been low, so his doctor has put him on a supplement. And Paul's wondering whether low vitamin D or the vitamin D supplement could be contributing to his poor sleep.
That's a great question. I will say that as a psychologist, my area of expertise is not in the realm of medication or supplements. However, what I can speak to is, in general, we have a circadian rhythm that helps regulate wakefulness and sleep. And so at any given time, we have a certain amount of wakefulness and a certain amount of sleepiness. And all of that is regulated by an internal circadian clock that's located in our brain, but also connects with the rest of our body as well. And so with vitamin D has been a supplement that has been studied extensively in MS for lots of different symptoms, including fatigue, and the interaction of vitamin D with other types of supplements to see if it would help do things like prevent relapses. So right now, vitamin D is kind of this really hot supplement that is the focus of a lot of research. And sleep has come up as part of that because we wonder if sun exposure, so light exposure, if light exposure helps regulate our circadian rhythm. And we know that light exposure in certain parts of the world, like really northern latitudes like Scandinavia, tend to get less light and tend to disrupt circadian rhythm. Vitamin D supplementation may be a way to help combat some of that disruption. That being said, I'm less familiar with in terms of clinical trials for vitamin D supplements when it comes to sleep. But that's a great question to ask your prescriber. If your prescriber has recommended a certain supplement at a certain dosage level, really asking what are the benefits, what are you specifically wanting to treat with that supplement, and what are the potential side effects?
Are you aware of other health conditions that may cause sleep problems?
Absolutely. So chronic pain conditions are probably one of the most common conditions that lead to disability in adults. It's one of the most common diagnoses within our population. And pain does interfere with sleep, and sleep interferes with pain. We know that people who get poor sleep tend to have more pain, and pain can also interfere with sleep. So chronic pain is probably one of the most commonly diagnosed and tied to sleep diagnoses that we have. Most other neurologic conditions will also have some kind of relation to sleep, because if sleep is regulated in the brain, most conditions, if they affect your brain, may also have the opportunity or potential for affecting sleep.
Before we continue our discussion, I just want to take a moment to welcome, to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box on GoToWebinar. MS navigators are online throughout today's program, answering your questions and connecting you to the resources that you need. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and friends. Dr. Hughes, lack of healthy sleep can cause or worsen MS symptoms like fatigue, cognitive dysfunction, and mood swings. As you mentioned earlier, fatigue is one of the most common symptoms of MS. Does poor sleep contribute to MS fatigue?
It can. So with fatigue being so common in MS, there are many different causes of fatigue. There are neurologic underpinnings that may increase inflammation, and that inflammatory processes can increase fatigue. Stress and depression, anxiety, and other mood problems can also increase fatigue. But we do think that there is a strong link between sleep and fatigue in MS. My colleagues and I completed a meta-analysis a couple years ago looking at about 50 different studies that measured both sleep and fatigue, and found across these studies there was a significant relationship between if someone had increased fatigue, they were also more likely to have increased sleep difficulties. Now, a meta-analysis is not a definitive cause and effect relationship. It was a systematic way of looking at multiple studies and looking at these correlations between these symptoms. So a lot more work is actually needed to determine whether treating sleep disturbance will actually improve fatigue. And there's some really exciting research happening now in the sleep medicine world to, if you're treating a sleep disorder like insomnia, will that improve fatigue in MS? And so, for example, Dr. Catherine Singh-Sukhan at the University of Kansas has been investigating that for the past 5 years and is showing a lot of promise in cognitive behavioral interventions for sleep disturbance in improving not just sleep, but also fatigue and other symptoms in MS.
Paul contacted us to let us know that in order to cope with his fatigue, he takes a 2-hour nap every day. But then he has trouble falling asleep at night. How can Paul manage his fatigue during the day so it doesn't disrupt his sleep at night?
Yeah, that's such a personalized question, and I love working with patients who are really so active with trying to manage their fatigue, right? So taking a nap in and of itself is a really effective and healthy way, or can be effective and healthy way of managing one's fatigue. But the problem becomes, I don't know if you've ever had this experience, but if you took a nap because you're fatigued and you wake up and you almost feel worse than when you first fell asleep, that
Right.
can be a sign, that can be a sign that your nap was too long and that maybe you started going into those deep stages of sleep. And the problem with that is when you get woken up from a deep stage of sleep, you tend to be more groggy. You might have some brain fog or cognitive fog. And just bouncing back into your daily schedule can be a challenge. And so when I'm working with patients of trying to navigate, how do I manage fatigue, but then also not be so awake at night, one of the first strategies is looking at the timing of a nap and how long the nap is. So typically naps lasting no longer than 20 to 30 minutes is a nice way of getting a little bit of reprieve during the day, but not allowing yourself to go into that deep sleep. Because as soon as we start getting into that deep sleep, you can kind of think of it as starting to decrease your sleep pressure. Over the course of the day, we all build up this sleep pressure so that when nighttime comes around, if that's when you typically sleep, you're ready to go to sleep. Every time you take a nap, and depending on how long you take that nap, it's like taking some air out of the balloon or taking away some of that sleep pressure. And so you have less of the pressure to fall asleep at night. So for some people, preventing any kind of nap during the day, but focusing on other fatigue management strategies is helpful, like focusing on exercise, which is a really important fatigue management strategy, or adjusting the timing and the duration of the nap can be another strategy so that it doesn't necessarily interfere with sleep at night. And a third option would be if you take a 30-minute nap in the day, pushing your bedtime back about 30 minutes. So all of these are all behavioral strategies that are usually part of a behavioral sleep regimen component, and whether that strategy is going to work for you takes a little bit of trial and error.
Jessica reached out to us saying she feels exhausted every day, but when she finally lays down, she can't fall asleep. She's wondering why that is.
That is such a common experience. We often use the phrase, I feel tired and wired, where you're exhausted and you feel like I should be able to go to sleep, but as soon as my head hits the pillow, my eyes pop open and now my brain is really active and I can't fall asleep. And there's a few reasons that happens. One can be if you have been struggling with sleep issues for a long time. And by long time, I mean anywhere from a couple months to decades. All right, this is the range of folks that I typically work with. Your brain has been trained at this point that the bed is not always meant for sleep. You can be watching TV, you could be on your phone, you could be worrying. Whatever it is, it's not sleep. And so your brain thinks, well, this is party time, or this is awake time, or this is not necessarily only sleep time. And so no matter how tired you are during the day, that bed is no longer representing a peaceful sleep environment for you. And when we talk about strategies later, we'll get into some ways to try to reverse that association. But that's one reason that sometimes you get into bed and you feel kind of wired. Sometimes other pieces of it can be the activities you're doing right before bed. We're all busy people. We're trying to fit in a lot in our day, and sometimes we don't eat until later at night before bed, or sometimes we can't fit in exercise until later at night. All of those activities, even if you're exhausted, if you're doing some of those activities right before bed, it can make it difficult to fall asleep.
Erin wrote in telling us that she's actually avoiding regular physical activity due to her fatigue, and now she's also experiencing sleep difficulties. Can lack of physical activity impact someone's sleep?
Certainly. So one, regular physical activity is a general health recommendation for all of us, but specifically for people with MS, multiple clinical trials now have shown that regular exercise can be effective for fatigue management. And so if you're not getting regular exercise, it seems counterintuitive, but regular exercise, whether it's with a physical therapist or with a physical trainer or on your own, can really help, one, regulate that circadian rhythm. It can help regulate other types of hormone functioning, which can also then help regulate sleep. So in the question of does lack of physical activity impact sleep, it certainly can.
Well, let's talk about the timing of that regular exercise. If you're exercising in the late afternoon or even in the evening, does that have any impact on your sleep?
It depends on the person, but in general, we generally recommend that people not engage in vigorous physical activity, particularly cardiovascular activity, about 3 hours before bed. And the reason is we get our heart pumping, we get our lungs pumping. It's a very activating kind of experience. And so if you're doing that right before bed, it's going to take a while for your body to regulate again and get the heart rate back down and ready for sleep. In terms of late afternoon or early evening, that may not be a bad time to exercise. It may not interfere with sleep, but again, everyone's a little bit different. So if you're finding that motivation is a big part of this. For some of us, if we don't exercise in the morning, it's just not going to happen. It doesn't work with our work schedule or our family schedule or any of these other things that we have going on. So figuring out the ideal time for you can be a interaction of your other commitments in life, but then also trying to not exercise within that 3 hours before bed.
Dr. Hughes, you've conducted research on the association between sleep disturbances and cognitive dysfunction in MS. What have you learned in your research?
So we have done some secondary analyses of other studies, meaning 5 years ago, a study was conducted on asking a different kind of question, like, does cognitive behavioral therapy help improve cognition in MS? And what often happens is, as a result of gathering all this data, we can ask other questions that weren't necessarily intended in the original study. And so I add that caveat in the sense that that's different than starting off with an initial research question and designing an entire study around this research question. But the research or the secondary papers that I have worked on have looked at a couple different questions. One, what is the association between mood and sleep in MS? And what are the associations between cognition and sleep in MS? And there are two things that are really important to keep in mind, that for sleep, there are different ways of assessing sleep. We can ask people to report the quality and the quantity of their sleep through self-report measures or surveys, or we can measure their sleep objectively through things like polysomnography or a sleep study. And we often find that the self-report data and the objective data are not well aligned with one another. And so then if we're looking at how either sleep measure relates to fatigue, they might differ quite a bit. And so one thing that we did find in our study is that self-reported measures tend to correlate most strongly with other types of self-report measures. So if you're reporting a lot of fatigue, you're more likely to also be reporting significant symptoms of depression and anxiety and sleep disturbance. If you're measuring objective measures of sleep, those don't always correlate with the self-report measures. So I think that's an important thing to explore, and all of them are important. I think historically, sometimes we downplayed as a medical profession, self-report measures were sometimes downplayed, and I'm here to say that the self-report measures are incredibly important because of their link to distress and to the experience of depression, anxiety, and cognitive fog. So we do see a connection there between when people are reporting poor sleep and their perceived cognitive dysfunction.
Can sleep disturbances help predict future cognitive decline in MS?
No, because sleep and the relationship of sleep in MS is a fairly new area of investigation over the past 10 to 15 years, we have a lot more data from other types of neurologic disorders and in the general population. So a publication in the past year did look at whether chronic sleep deprivation or chronic sleep disturbance over time was related to progressive memory decline in a very large community-based sample of adults, so not specific to MS. And we do see a link between sleep deprivation or poor sleep chronically over time and memory impairment later in life among older adults. If we were to extrapolate to that to MS, we know that people with MS are already vulnerable to some cognitive impairment or to some cognitive decline over time. And so as this evidence continues to come out, certainly taking care of your sleep health now, beyond just being a general good health behavior to engage in, it may also prevent cognitive decline in the future or help slow cognitive decline.
I think most people know firsthand that sleep affects our mental and emotional state. I'm sure we've all experienced getting out of bed in a bad mood due to lack of quality sleep. How does sleep affect our mental and emotional health?
So we know through sleep study data that when one is chronically sleep deprived, or particularly when certain stages of sleep are restricted, then that directly impacts mood. So depression, for example, can be brought on by chronic sleep disturbance. Similarly, if you are deprived of sleep, that can also trigger things like manic episodes for people with bipolar disorder, or it can bring out symptoms of hyperactivity even if you don't have bipolar disorder. Maybe you had an experience where you pulled an all-nighter, and instead of feeling exhausted at 9 a.m. the next morning, you kind of felt wired. And again, it's kind of like your body's survival mode kicks in. But when you're in that survival mode, that can also lead to anxiety. It can affect your mood. So sleep certainly does affect our emotional health, and it can swing in different ways. For some, it can increase anxiety. For others, it can increase depression symptoms. For others, it could trigger a bipolar episode. So it really is important from mental health, not just if you have one of these diagnoses, but also if you don't have a mental health diagnosis, it can certainly affect your mood in that way as well.
We've been talking about some of the ways that sleep can affect our minds and bodies, but how about our immune system? Are people with MS who are experiencing sleep disturbances more vulnerable to catching colds and getting sick?
So this is another great question in terms of what we know from other research. It would be unethical to do a study where we try to test someone with MS's immune system by exposing them to the flu or exposing them to some other kind of virus. But there has been research in non-MS populations, or in adults who don't have a neurologic condition, with healthy college students, for example, where college students would be sleep deprived for a period of a couple of days versus not sleep deprived, and then exposed to a potential virus, and seeing how their immune system works to fight off the virus. And so this research is now decades old, but it was a really sophisticated design in terms of looking at how sleep disturbance or sleep deprivation can suppress the immune system and make us more vulnerable to getting sick. And so again, that idea of if you went to college and you went through an exam period and you got through your exams, you pulled a bunch of all-nighters, you got through, and then the day after you turn in your final papers, you start getting cold symptoms. It really is a bummer to start your winter break or summer break with a cold, but that is often an experience by college students, by physicians or other medical providers who do a lot of long stretches of work where they're up for many hours. They're more likely to get sick in that way. And so if we translate that to MS, again, we don't have a randomized controlled trial of whether someone gets infected with a virus or not. But we do know that if your immune system is already affected by MS, or if you're on, for example, an immunosuppressant medication, sleep can interact with that to potentially make you more vulnerable.
And can lack of sleep impact how fast someone recovers if they do get sick?
Yes, that can also be a factor. As I mentioned, when we are sleeping, we used to think of sleep as a very passive process, that not a lot is happening in the body when we sleep. And now we know that that's absolutely not the case. There are so many active processes happening in the body, including restoring and healing. So there's a lot of, I call kind of taking out the trash in the brain, that our cerebrospinal fluid starts to clean out the brain and do some other things that help us restore function. And so if our sleep is impacted, it can slow that healing process, or can sometimes interfere with that healing process. And so if we are taking longer to heal, that could be impacted by sleep.
And what are the effects of long-term lack of sleep?
Well, it kind of depends on a lot of factors, including other comorbidities and other medications that you may be on. I'd mentioned some of the research on long-term cognitive effects of chronic sleep disturbance that potentially increases risk for dementia or other types of memory disturbances later in life. It can also affect immune functioning. And in MS specifically, again, we're still collecting longitudinal or long-term data on what that looks like in terms of long-term effects. From a mood standpoint, it does increase risk for depression episodes.
Certain lifestyle changes can help improve sleep for people living with MS, and perhaps the simplest place to start is with sleep hygiene. Can you tell us what sleep hygiene is and how it can help with sleep difficulties?
Absolutely. So one caveat with this, that this is really where I love to talk to patients about their sleep, because oftentimes we've heard of this term sleep hygiene and what sleep hygiene is. And that's a lot different than another concept that I'll talk about in terms of behavioral sleep interventions. Sleep hygiene, we can kind of think of as the brushing our teeth of sleep, where there are certain things we can do to try to promote our sleep health, like trying to have a consistent bedtime and wake time, trying to have a wind down period at night before we go to sleep. These kinds of strategies can help get our mind and our body ready for sleep and help our body adjust to that schedule. That's something that, whether you have a sleep disorder or not, are just general health behaviors that are beneficial for us. There are things like, with that wind down period, you might have a sleep routine. And so we think of, again, with babies, from an early age, you might develop a sleep routine so that they can get into the habit of going to sleep at a certain time. From a treatment standpoint, however, there are some more specific scheduling of sleep and sometimes even restricting of sleep to promote better sleep health, which is separate from sleep hygiene.
Adele wrote in and told us that her doctor has asked her to start keeping a sleep diary. What is a sleep diary, and how can that be helpful?
Well, a sleep diary is exactly what it sounds like. It's a log or a book that you track your sleep over a period of time. And because all of us have variations in our sleep, sometimes we sleep more on the weekends compared to during the week. Sometimes we just have a poor night of sleep here and there. And as I mentioned earlier, generally, as human beings, we are very poor at recalling our sleep, especially if we're chronically sleep deprived. So keeping a diary allows us to be a little bit more, or a lot more, accurate in how we're recalling sleep. So your doctor may ask you to keep a diary for 2 weeks or a month before an appointment to really look at what your pattern is. Because our recollection tends to be very biased toward the worst nights and the best nights. or the most recent nights. So if you slept great the night before a sleep study and someone asks you, how's your sleep been? You might say, well, it was bad for a while, but it's been okay recently, even if maybe it was just that night before. And similarly, if you had a really poor night of sleep the night before, it may bias to thinking that the sleep issues have been more severe than they really are. So it provides a little bit more, we call it ecological validity or momentary assessment of that sleep.
Celeste has told us that she's taken medications to help her sleep in the past, but she's still having difficulty sleeping. Can medications be used to actually help someone get the quality sleep we were talking about earlier?
Yeah. With the caveat again that I'm not a prescriber, so I would certainly encourage everyone to ask your prescribing physician any questions you have about sleep medication or sleep side effects. But what we do know is that many of the medications that are used for sleep disturbance or to help people get to sleep, sometimes the effects of sleep were discovered by accident. So really the medication was developed for something else, but because it made people sleepy, it became a sleep medication. And indeed, that can help people fall asleep. The problem is if it's not helping people stay asleep, or if it's not allowing people to cycle through each of those really important stages of sleep, then even if you slept 8 hours, you might not be getting the quality of sleep that you need, or you might not be getting the same benefits that you would if you were going through those stages without the medication. And again, it's a really difficult balance, and talking to your provider about the risks and benefits of various sleep medications are really important, especially if they have any impact on your breathing or if they have any other interactions with other medications you might be taking.
There's been research that's looked at the effectiveness of cognitive behavioral therapy in treating insomnia. What can you tell us about cognitive behavioral therapy, or CBT as it's known?
Sure. So cognitive behavioral therapy, or CBT, is a series of strategies that help us understand the connections between our thoughts, our emotions, and our behaviors. Because certain thoughts that we have that pass through the day, we may have emotional reactions to them. And these could be thoughts about ourselves, they could be thoughts about other things happening in our lives. And our emotions are also connected to our brain and our biological processes. And that can also affect sleep and then affect how we react to those emotions and react to those thoughts. So, for example, with worrying is a behavior, but it's usually a behavior that is produced because of anxiety, right? Or an emotion that we're having about some event that happened. So CBT, in working with a therapist who's trained in CBT, helps us break down what are some triggers or events that happen in our life that trigger certain automatic thoughts or beliefs that we may have about ourselves or about the world. Are some of those beliefs true? Are there aspects of those beliefs that are untrue? How can we reframe some of those if they're untrue? Or even if they are true, but they're not helpful to us in functioning in our life, how can we manage some of those thoughts and those emotions more effectively? When it comes to insomnia, CBT was adapted specifically for insomnia symptoms years ago. And really, it evolved with insomnia, and CBTI has become the number one treatment, or the first line of treatment for insomnia, before medication, before other types of interventions. And with CBTI, it has been investigated in people with MS. I'd mentioned Dr. Singsu Khan earlier. She's done multiple clinical trials now looking at the efficacy of CBTI in MS, and has shown that compared to education or compared to other types of control conditions, CBTI is effective. And if you think about not just worry about life, but if you're worried about your sleep specifically, CBTI helps to bust some of the myths that we have about sleep and help us have a more healthy relationship, not just with sleep, but also with wakefulness. Because sometimes sleep disturbance or insomnia comes out of this desire to make ourselves fall asleep, and it becomes a trap where the harder we try to fall asleep, the less successful we're likely to be. And so CBTI allows us to maybe disentangle some of those beliefs and that struggle that often happens with sleep.
Luke wrote in and told us that he was diagnosed with sleep apnea. He's looking into continuous positive airway pressure, or CPAP, as a treatment. What is CPAP, and how does it help people diagnosed with sleep apnea?
Sure. CPAP is a treatment where Air pressure is delivered through the nose and mouth, usually with a mask, using a machine at night. And the way that it functions is it delivers oxygen in a way that helps keep the airway open. So if you're someone who happens to have obstructive sleep apnea, there's a part of your airway that becomes narrow or collapsed, and it interferes with sleep, and there are pauses in breathing at night. And so the CPAP machine ensures that that air continues to get in, because when we're not breathing, we're not getting oxygen. When we're not getting oxygen, our brain is not getting the food that it needs to function. And so from a survival standpoint, it's a really important treatment. CPAPs have evolved considerably in the past 10 years. They used to look like, I don't know if you're a Batman fan, like a big Bane mask on your face, and could be really disruptive at night. And people really didn't want to wear them because they were honestly pretty uncomfortable. But it's something that our body is really resilient to adjusting to with practice. And so working with a psychologist can actually help desensitize you to wearing that mask and being able to sleep with that mask. And the masks have become much more smaller profile over time, to be things that sometimes one could just go into the nose and not cover the whole face. And so the comfort of these devices has changed significantly over time.
As somebody who lives with sleep apnea, I can attest to all of the above, and it is far easier to live with lately than it was earlier, for sure. You shared a lot of great information with us today. What would you say are the top 3 takeaways that you'd like our audience to remember?
Oh, that's hard. I would say to start with that because sleep is a health behavior, behavioral changes can be a primary treatment for sleep disturbance. I mentioned that with insomnia, CBTI is the first line of treatment for insomnia. And so helping us recognize that there are things that we can do in our life without adding another medication, without trying to go to extreme lengths to try to fix the insomnia. That can be done with some behavioral adjustments. The second would be from a comprehensive interdisciplinary care standpoint. If you're reporting sleep issues and one of your providers does not respond, continue to bring it up. And whether that's with your primary care doctor or your neurologist or a psychologist, keep bringing it up until someone responds, right? Or in your appointment, say, this is the most important thing that I want to address in today's conversation. And even if that provider is not a sleep specialist, that will really signal that this is something that is interfering with your life, is something that you want to address and can help get you to the care that you need. And then finally, I think the understanding that any kind of behavior change, including sleep, does take time and take some trial and error, whether that's a new medication or changing your health behaviors like sleep. And so working with a specialist can be helpful, that it's not necessarily going to be an overnight fix. However, CBTI, for example, has shown efficacy in as little as 2 to 3 weeks, depending on the type of program that you're in. So even though sometimes it can feel like it gets worse before it gets better, or it's really hard to make those changes at times, the benefits on the back end, and fairly quickly compared to other types of psychotherapy, the evidence is there that it can be very effectively treated.
I'm going to circle back to something. Earlier on, we kind of identified insomnia, sleep apnea, restless leg syndrome as some of the more common sleep disturbances that people with MS might experience. And we've certainly talked about some strategies to deal with things like sleep apnea and insomnia. I want to circle back to restless leg syndrome. Can you give us a couple of strategies that might help best manage that?
Sure. There's actually some evidence now that CBT can be effective for managing restless leg syndrome. And the reason being that when I was describing what those symptoms feel like, it probably didn't sound very pleasant, right? It's a very unpleasant sensory experience. And whether it's itching or pain or spasticity, oftentimes this can elevate our level of frustration and start that wheel going of, oh my gosh, this is so miserable. This is never going to end. The cycle of catastrophic thoughts that come with the restless legs. So CBT can be an approach to addressing restless legs. Another piece can be thinking about your environment or your sleep environment. If you tend to be more heat sensitive, this is where a sleep diary also comes in handy. Sometimes restless leg syndromes can be exacerbated by temperature. So if you tend to have symptoms that are exacerbated in hotter environments, trying to cool your sleep environment down to a lower temperature can be helpful. Sometimes people respond to pressure. So having more pressure on one's legs when you're trying to fall asleep, like for example, using a weighted blanket. For some people, they do experience relief, although that's certainly not universal, and there's no RCT showing that weighted blankets are helpful. It's more looking at what are some strategies to help mitigate some of that discomfort and managing the discomfort.
Well, I'd like to thank everyone who submitted questions, and thank you, Dr. Hughes, for being with us today.
Absolutely. And one more thing about the restless leg piece as well, because this is a newer of the sleep disorders compared to insomnia or CPAP and sleep apnea compared to our other understandings of sleep disorders, there are emerging studies on different kinds of medications and other symptom management tools. So always good to ask your neurologist or sleep medicine specialist about that, because that would be a little bit further outside my area of expertise.
Well, again, thank you for sharing all of this really great information with us today. Speaking about great information, I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be credible and current. To learn more about sleep and MS and find resources about sleep, please visit the National MS Society's website at nationalmsSociety.org/livingwellwithms/diet-exercise-healthy-behaviors/sleep. There's a lot of slashes and there are a lot of hyphens in all of that. So please pay attention to the URL that you see on your screen. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk a listen. You can find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'll remind you that it's a season to not just ride, but bike MS. Bike MS is more than the ride of a lifetime, whether you want to cross the finish line in person or take on a challenge from anywhere. There's a Bike MS program that's right for you. Find out more and be sure to register at bikems.org. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. I'd like to thank Dr. Abbey Hughes for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. I hope you'll join us again for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute and please fill it out. On behalf of Dr. Abbey Hughes and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.